Um, Two questions on a similar topic on how thresholds are established. That one, the argument is they're very subjective and by design. So the problem with putting absolute numbers on things is that the implication is that should necessarily trigger action, and that's not a particularly effective way of driving policy, I don't think. So the idea is there's various thresholds at different points. So the first threshold, and step back a second, when this was done in Cambodia and Afghanistan, it was immediately clear when you talk to people in the country, sort of national experts on the country, in the country, what are the top threats that meet these rough criteria. They just jump out. And I think as long as you have a regional focus on it, I have no reason to believe that won't be the case in other places. If you then go to, say, a health expert in a country and say, what are the top 3 or 4 things that cross these thresholds, again, they almost always jump out. And there might be cases where that line is ambiguous, and if that's the case, more threats likely get included. So there's a degree of subjectivity there. The way that gets limited, though, is in a few ways. One, you are only looking for the top threats in any one of these categories, so all of a sudden you're limiting it down there. The second way is you're only looking for where that threat is the very highest, so the data is broken into, in this case it was quintiles, so you're only looking for the very highest, and then with that you're looking where it's overlaid with other ones, so by the time you get down to that final hotspot map, you're really looking at where what have been identified as the worst threats are at their worst point, and where they're matched with other threats that are also the worst. So there's levels of filtering that happens each step down. And like someone else asked about to show the hotspot map, and it was all red, and I won't pull it up, but there's actually degrees of red, and the darkest, it's degrees of red in the sense that most locations had at least one of those 13 threats at this high level. But the darkest red were the location that had 5 to 7 of those 13 threats. Any 5 to 7 of those 13 threats that had met that threshold. On the health consequences or the policy consequences of health being by far the biggest human security threat, and there were 2 on that. I guess both questions were referring to, does this mean all of our policy should be health policy? If these are by far the biggest, I guess this crowd's probably a little biased, and it probably should be. But I think the question is whether health is a proxy for other things. So is it just a proxy for underdevelopment, and therefore is economic development a better tool to address that than targeted health action? I don't know that. I'm sure that's different case by case. And the other answer would be yes. I mean, I do think so. I do think it should be prioritized. And you get the same thing with car accidents all the time. People always ask that if you're looking at preventable death, if human security looks at preventable death, in the developing world, should car accidents be considered a human security threat? And I actually think they should be. I mean, when I was working in Cambodia, there were 2 to 3 deaths in Phnom Penh alone a day from moto accidents. To me, that's a clear human security threat, and it should be considered it. And I don't know why we wouldn't. On where did Human Security Report get their mortality statistics? I just looked it up. It's UNICEF, the Interagency Child Mortality Estimation Group, and the World Bank are those declining trend line ones. You said that just before the outbreak of war, conflict mortality rates were decreasing. I don't think that's linked to anything to do with the outbreak of war. That's just the trend that was assessed before the conflict started. And that's due to those things that were mentioned in the report, which increased humanitarian assistance and development effectiveness, immunizations and vaccinations, and so those 3. Should R2P use thresholds as well? So R2P should have to pass thresholds. I think they do, right? The problem is their threshold, what they're triggering is military intervention, so the threshold's way higher. And the threshold is necessarily violence-based. So theirs is mass atrocity, genocide, can't remember exact terminology, but it's broader than genocide, but not much. It's genocide and mass atrocities, I think, is how they define it. And that threshold got higher and higher the closer R2P got to the Security Council. So when R2P was being lobbied originally, that threshold was way lower. But as it got closer and closer, it seems, my understanding is, closer it got to the Security Council and actually meaning anything, the higher the threshold that got. And now I don't even think it's an absolute threshold. It's not sort of a necessary trigger. Although there's a whole new project in Canada called the Responsibility to Prevent, which is supposed to be the responsibility to act, and it's about the policy side of responding to those R2P thresholds. And they're actually saying stuff like there should be national triggers in countries to engage if that threshold, like policy triggers to engage if that threshold's met. I personally think that's kind of crazy, but the main difference is the thresholds are different because they're talking about military intervention to stop mass violence, and that's just a totally different threshold. But then for development assistance or humanitarian assistance, that's it. All right?